Newsday continues here on One News Now. I'm Charles Dejano. The Octa Research Group flags the increase in COVID-19 deaths, especially in the National Capital Region. Greg Gregorio now joins us live from Mandaluyong to give us more details. Greg, good afternoon. Could you tell us the current case fatality rate in Metro Manila, and where did the Octa attribute this increase?
Yes, Charles, according to Professor Guido David of the Octa Research Team, the current case fatality rate in the National Capital Region is at around 2.02%. That is much higher than the 1.8% case fatality rate recorded back in October 2020. Guido said that is equivalent to around 200 individuals dying from 10,000 cases of COVID-19. And when we asked where do they attribute this increase in case fatality rate, Dr. Guido said they don't have an exact answer to that, but they think the factors could be the transmission of the variants of the SARS-CoV-2 in Metro Manila in various parts of the country. Also, the overwhelmed healthcare capacity, specifically in the National Capital Region. Dr. Guido further explained that many people are having no access to hospital care, which leads to death sometimes. Charles?
Right, Greg, we are in day one of the MECQ. Could you tell us the reproduction rate now in NCR and what the Octa think about this?
Charles, according to Dr. Guido, the current reproduction rate for the National Capital Region is at around 1.24, and it is already much lower compared to the above 2 reproduction number weeks before and the 1.53 a week ago, and now it's 1.24. They are hoping that the reproduction number may become lesser in the coming weeks and even below 1, which is the ideal for which would mean that we are already in control of the transmission. But according to Professor Guido, this may still be seen in the coming weeks under the MECQ. Charles?
Right, based on what the Octa Research Group is saying, based on their projection, how many cases are we likely to see by the end of April?
Charles, according to Dr. Guido, even though we are seeing quite a downtrend of the reproduction number, we are still expecting, or we may be seeing around 1 million total number of COVID-19 cases by the end of April. That's why they are hoping that with the MECQ, we will be able to slow down the increase of COVID-19 cases in the country. Charles?
Right, let's zero in on that for a bit, Greg. Does the Octa Research Group think that this 2-week MECQ will actually be effective insofar as lowering the overall cases?
Actually, according to Dr. Guido, implementing MECQ over the next weeks is part of their recommendation. Guido said it's either ECQ or MECQ because they think that placing the Metro Manila and other neighboring areas under MECQ would still be equivalent to controlling or further controlling the transmission of COVID-19 cases in the National Capital Region. Charles?
Okay, Greg, the Octa also made recommendations as regards the ayuda distribution in some areas where residents have gathered and lined up to receive cash aid. What did they have to say about this?
Yes, Charles, Dr. Guido specifically highlighted that these ayuda distributions causing long queues of beneficiaries could be a potential super spreader event for the COVID-19 transmission. Thus, they hope that local government units would look into it and possibly take necessary measures as to perhaps this a door-to-door system or by an appointment system. Charles?
Right, Greg, moving on now to the Department of Health. What is the agency's assessment of this 2-week ECQ, or MECQ rather?
Charles, according to Health Undersecretary Maria Rosado Vergere, the number of cases as impacted by the recent implementation of enhanced community quarantine over the National Capital Region and the neighboring areas in the last weeks could still be seen after 10 to 14 days. But as part of their initial assessment is that during this ECQ, we were able to add around 3,000 isolation and ward beds in various hospitals and also around 164 ICU beds across hospitals in the National Capital Region. Aside from that, they were able to distribute PPEs and ventilators to hospitals across Metro Manila. Charles?
Right. Greg, do we have any updates on the new COVID-19 variants?
Yes, Charles. According to the recent biosurveillance report of the Philippine Genome Center and the Department of Health, hundreds of cases have been detected under the B117, B1351, P.1, and the P.3. But as of now, according to the Department of Health, we still don't have any conclusion yet if there is already a community transmission of these SARS-CoV-2 variants in the country, as the investigation with the World Health Organization is still ongoing. And at this point, what they are looking into is to strengthening the biosurveillance system in the country. Charles?
Thank you, Greg Gregorio, reporting live from Mandaluyong. The head of the country's vaccine expert panel reiterates that the benefits of AstraZeneca's vaccine outweigh the risks. Dr. Nina Gloriani told Agenda that the number of blood clot cases linked to the shot is much lower compared to other medications, including birth control pills. Gloriani also explained that the adverse event was not only reported from the AstraZeneca jab, but also for the vaccine made by U.S. pharmaceutical firm Pfizer. The use of the Oxford-made shot for those aged below 60 has been suspended in the Philippines pending recommendations from local and foreign experts.
If you look at the totality, yung total na injected, that's about 20 million. Eventually, ang naging computation is about 4 such events per 1 million. So mababa po yan.
Here are other vaccine updates from around the world. A real-world study in Israel found that the South African COVID variant may evade the protection provided by Pfizer and BioNTech's vaccine to some extent. Researchers, however, noted that the study only had a small sample size because the variant is rare in Israel. South Korea will resume its vaccination this week after suspending the rollout of AstraZeneca shots among those below 60 years old. The Korean Disease Control and Prevention Agency says people aged 30 and up will now be vaccinated, but those below 30 will still be kept out pending review for extremely rare cases of blood clotting among Astra vaccinees. And China is looking at mixing COVID-19 vaccines to boost vaccine efficacy. Beijing health officials are also studying the possibility of changing the number of vaccine doses, as well as adjusting the lead time before the second shot to solve efficacy issues. 40% of COVID-19 vaccines distributed globally have gone to the 27 richest nations of the world. As a result, wealthier countries have vaccinated residents at a rate 25 times faster than least wealthy nations. Let's crunch those numbers in this Bloomberg Quick Take.
As of Thursday, 40% of the COVID-19 vaccines administered globally have gone to people in 27 wealthy nations. That represent just 11% of the global population. Countries making up the least wealthy 11% have gotten just 1.6 of COVID-19 vaccines administered thus far. This is according to an analysis of data collected by the Bloomberg Vaccine Tracker. So in other words, countries with the highest incomes are vaccinating 25 times faster than those with the lowest. The U.S., for example, has 24% of the world's vaccinations, but just 4.3% of the population, while Pakistan has 0.1% of the vaccine coverage for 2.7% of the global population. The pattern is repeated across the globe and follows efforts by wealthy countries to pre-purchase billions of doses of vaccine, enough to cover their population several times over. That's according to a separate analysis of vaccine deals. Well, joining me now to discuss the effects of uneven vaccine distribution is Associate Professor of Epidemiology at the Johns Hopkins Bloomberg School of Public Health, Carrie Althoff. Dr. Althoff, thank you so much for joining. What are the global implications when we see this play out, when only wealthy nations push ahead when it comes to vaccinations and poorer nations are so far behind?
So I think what we've all learned through this is that we are all connected, right? And when we think about the scale at which global travel was occurring before the pandemic and how eager some countries are to get back to that, if we have countries where they do not have access to vaccination, we are not going to all be protected until everyone has access to that vaccine. So this has major implications for how this pandemic will continue to evolve. And as the U.S. continues to vaccinate, it should also be noted, I think one part of the numbers that maybe was missing is this idea that 31 million people in the U.S. have been infected, and the second country with the largest number of individuals infected is 13 million in Brazil. So there has been a disproportionate number of cases in the United States, and once that fire gets put out, right, we will see other places in the world too where things continue to balloon. And if they don't have access to vaccine, how are we going to help stamp that fire out?
So the economic element, the health element is certainly a huge part of this, right? The fact that the nations where they don't have access to vaccines the same rate that wealthier nations do continue to face the economic consequences and, of course, the devastating health consequences of this. But there's also the part that you mentioned where we're all connected, Professor Althoff. And I wonder about the way that variations and mutations can occur to the virus as it continues to go sort of really like unattacked and just run its natural course in areas of the world that aren't vaccinated, and to what extent some sort of new mutation could arise that could make the vaccines that we have developed less effective.
That's right. I mean, that is a concern, and this is why the continued surveillance of the different variants is so key, not just in any one country, but globally. And as we've said before, you know, replication is the opportunity for mutation, right? For those different mutations that can create variants to which, you know, a vaccine may not be as protective. We have not seen that yet. We are still operating with very high quality vaccines that are giving us some broad coverage. But just as you point out, if we have places in the world where the COVID virus is replicating quickly and burning through populations, those are the places where we could potentially see new variants from mutations.
For more updates, visit News 5, the Philippine Star, and Business World Online. You can also visit our website, onenews.ph, for more in-depth analysis. And you can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Charles Lejano. We are One News.